Croydon Vision Facebook Live event, our weekly event. So I hope you enjoyed last week. Last week was all about the power of volunteering and how you can learn things, give back to the community, or learn new skills and get ready for employment. So I hope you got a bit of inspiration from last week's event. And just before we go on to this week, just a little note for next week. We're going to have Suzanette, our CEO, talking about sort of diversity and inclusion. So come and join the conversation with us next week. So this week we have with us, Dhruvin. So just before I introduce Dhruvin, I'm going to kind of describe myself, because when we had Marcus from the Tate Modern, he described himself and people really liked it. So just to let you know, I'm wearing a kind of a brown golden top with short sleeves. I got my Croydon Vision lanyard and photo sort of hanging off my neck. And I have my earrings on, have a ponytail, and for you, just for information, I've got green eyes. So that's me sort of presenting the Facebook Live today. So our guest speaker, Dhruvin, do you want to, hello, welcome, and do you want to introduce yourself to our viewers?
Of course, thank you so much, Odette. Hello everyone, to all that are tuned into this Facebook Live event. My name is Dhruvin Patel. I'm very pleased to be here and letting you know all about the eyes today. A little bit about myself. I'm an optometrist and I've been practicing for just over 5 years. I've worked with the likes of the Specsavers, the Boots and the Vision Expresses. I also spend a lot of my time focusing on researching something known as harmful blue light, which can be emitted from lighting and screens around us. So I also have a business which creates screen filters which limits blue light, as well as some glasses and lighting products. And a fun fact about myself, my favorite food is pizza, and I'm sure it probably is for a lot of other people. I mean, it's simple and it's very hard to get wrong, pizza. You know, there's only so many places that do it wrong. And an audio description of myself. I'm not wearing too many items like Odette, but I do have an orange activewear t-shirt on and white pajamas. I do also have dark hair and brown eyes.
Fantastic, thank you. That's an excellent description. Thank you. So today I'm gonna be asking Dhruvin about a few eye conditions. Then we'll ask him, what if this happens to me, to my eyes, and what should we do? And then we're going to kind of look at different urban myths on eyesight, a bit like, well, if you eat carrots, can you actually see in the dark? And that kind of fun sort of fact. And we'll have Dhruvin's view on, is it true or is it false? Or just comments on it. So we'll have a bit of fun at the end. So let's start with the eye conditions. So I think our technician is going to put the image of the eye condition up behind me as we go along. So let's start with glaucoma. So Dhruvin, in very simple words, so that if somebody wanted to know kind of what is glaucoma, because they've heard their grandparents had glaucoma, or somebody, their friend or whatever, what does it mean when somebody says, oh, I've got glaucoma? What does it kind of mean? What happens?
Sure. So to give you an idea, someone who suffers from glaucoma has tunnel vision, so they have peripheral vision loss. Now, what it means to have glaucoma itself in your eyes, you have the eye which transmit information to the brain via something called the optic nerve.
Yeah.
And glaucoma, the optic nerve gets affected and the nerves within it are damaged. Therefore, the information processing and signaling to the brain is affected. And this is because of fluid in the eye building up and pressure building up. Wow. And that puts pressure on that optic nerve and therefore affects the vision we see. And as I said, it typically starts with peripheral vision loss, and that's how it affects most people. And it can be in one eye or both eyes, and it can create blind spots as well, because the way glaucoma happens, it's quite slow in most cases, and it happens in different areas of visual field where one eye might be perfectly fine, and it kind of masks the visual field loss in the other eye. So glaucoma is one of those tricky ones where if you're not, regularly getting your eyes tested and having a visual field examination, that it can get missed. So it's always important to check your eyes, and especially if you have a family history of glaucoma, it's even more important.
And Dhruvin, is it something one can treat glaucoma? Is it treatable?
Yeah, so you can manage glaucoma. Unfortunately, once you have that vision loss, it's hard to get that back, but you can manage it to keep it at bay. And one of the main treatments to manage it is things like eye drops that reduce intraocular, which is inside the eye's pressure. As I mentioned, the increasing pressure and fluid is what affects the eyes. You want it to be below a certain value, which is different for everyone, by the way. The average is intraocular pressure. They have readings of 20. Anything above 20 usually is sometimes warning signs. Anything above 30 is when it's causing damage. But in some cases, even some people need to keep that pressure below 10. Because their eyes are really sensitive to heightened, increased pressure in the eye. So an ophthalmologist usually recommends what's best there when they have a little more of an in-depth look.
So Dhruvin, another question is, so how often should, say if you had somebody in your family who suffered from glaucoma, how often should you have your eyes tested? What's the kind of recommendation?
Yeah, if you have any parents, children or siblings which suffer from glaucoma, you should be getting your eyes tested every year.
Right, okay, so that's for our viewers. I hope you hear what Dhruvin is saying. So thank you, Dhruvin, for this kind of description of glaucoma. Let's talk now maybe about a cataract, because we hear a lot of older people that say, oh, I'm going to have a cataract operation. So what does it mean, having a cataracts?
Yeah, so cataracts is effectively, if you imagine your eyes, let's imagine windows. When we're looking out the window of the car, the window is nice and clear so you can see out of it. Now, effectively in the eyes, we have a window as well. It's known as the lens. When we're born, the lens is nice and clear, but as we get older, due to UV light, it can become a little bit tainted, so it changes color, becomes a bit brown, yellowish, and then also due to structural changes within what's in the lens, it also becomes hardened and thicker. So what was once a clear window is now, let's imagine, mucky, it's brown, it's yellow tinted, it's hard to see out of. You're going to clean that window. If it was your actual window, you'd want to get a spray out and a cloth and clean it, but you can't do that, right?
No.
So, what happens, the lens becomes tainted and it stops you from seeing outside. Effectively, light isn't getting into your eye and you stop seeing well. Therefore, they say a cataract has formed because the lens has now changed. And this will affect people's vision in many ways. So in terms of color, they'll have trouble finding out which color something is to a, down to a T. Contrast sensitivity becomes very difficult. And then at latter stages, just generally seeing and being able to identify what a letter is, or being able to read can become difficult. So that's what cataract.
So Dhruvin, so is there a cure? Is there a treatment for cataracts?
Yeah, so cataracts. There's a few types of cataracts, but the most common cataracts can be solved quite easily. It's one of the most common surgeries that are done, and actually have the best success rates out of a lot of surgeries that are done within any secondary care, so any hospital setting. And effectively what will happen is you go in, it's usually a 20 to 30 minute job. It's very quick, very surprising actually. You think with the eyes they need to it probably sounds more horrible than it is, but they'll put local anesthetic on your eye, and they'll keep your eyes open, so you're awake when they're doing this. And with the local anesthetic, they'll take an incision of the front of the eye, and then they'll take out the lens and then put in a new lens. So effectively, it's like changing the windows of your house if they've become dirty, and you get a fresh pair of lenses.
So is it a bit like a contact lens in a sense?
Well, it's interesting you say that because obviously contact lenses go on the front of the eye.
Yeah.
But this is a lens that goes actually within the eye, so behind
Ah,
the cornea.
right.
And then they stitch up the front of the eye, so it's not something that moves around in the front. It's just in the eye itself.
Ah, right. Interesting. Okay. And again, is it something that is genetic, that if you have it in your family, you're more likely to have it?
With certain types of cataract, that is the case. But for
Right.
most of us, I'd say 80% of us, cataracts are just one of those things that everyone usually gets. It
Okay,
just depends.
eventually.
It
Yeah.
just depends on how long you live. If I'm honest,
Yes,
the
yeah,
longer
yeah.
you live, the more likely you're gonna get a cataract and need to get it removed. And also, us British, we don't get a lot of sun, so traditionally we we do get away with it. But if you've grown up in a hot
Ah,
country,
yeah.
or you're someone that likes to take a lot of holidays, then you're going to need the cataract removal maybe earlier, maybe in your sixth or seventh
Right.
decade, rather than
You
someone who
you
needs
did
it.
mention the UV light, so you'd recommend if people go on holiday or if they do a lot of outdoor activities to actually wear sunglasses.
Yeah, so a lot of people make the mistake of only wearing sunglasses when there's direct sun outside.
Right.
But when you go to hot countries, or even the English sun is also very powerful. I might want to add, in the summer days,
Yeah.
even now we've seen some of the sun coming out. On an overcast day, there's actually 25 to 50% more UV light than a normal day. That's
Oh
because
wow. Okay. Oh, I
the
didn't know
clouds
that.
actually reflect a lot of the sun. And although it doesn't seem like it's sunny outside, there's a lot of UV light exposure. So even on an overcast day, I generally recommend, if someone wants to make sure that their eyes are being least affected by UV light, is wear sunglasses even on the
Okay.
days that are overcast.
Okay, well, thank you for that, Dhruvin. Now let's see, we've got two more eye conditions. So retinopathy, what is retinopathy and why do people get it? What is it all about?
Yeah, so I believe you're talking about diabetic retinopathy there.
Yes, because we have I think that it's quite prevalent in London as well. There's quite a lot of people who have diabetes. Not everybody gets that, their eyes affected, but if they do, why do they, and what does it mean?
Yeah, so diabetic retinopathy, a big telltale is in the name actually of where it comes from and why, and it's due to the main disease within your body of diabetes. And if people have poor sugar control, maybe
Yeah.
due to their diet, or more also, due to being type 1 insulin problems, they can have diabetic retinopathy because the sugar levels within their blood are not being controlled. Now, diabetic retinopathy affects the eye, similar to glaucoma, but it can also affect your central vision, because what happens is, because of so much glucose or sugar in the blood vessels at the back of the eye, which is the retina, the retina has so many little rods and cones. So these rods and cones send thousands of messages to the brain.
Yeah.
Now, when you have a vessel in the retina which breaks, you have blood which leaks out. And once that blood leaks out, and let's say, when you cut yourself, you get a scab, right, when it
Yeah.
heals.
Yeah.
But in the back of the eye, when it heals, it actually creates a problem, because then
Yeah,
that
the
rods
scab,
and cones cannot get any information. They can't transfer that light information to the brain.
So do you mean that in a sense that it's like the cone switches off, in a sense?
Exactly. Yeah. So the rods and cones switch off, and what happens then is you get scattered vision loss, depending on where that blood vessel has burst in the back of the eye, because in the back of the eye there's no rules. Those blood vessels can burst anywhere, and that can affect any part of your visual field.
Right.
So that's why with diabetic retinopathy, that's the one condition where the visual loss, there's not really a pattern. It's usually can be anything dependent on that person. But what I would say is, it does take many years for it to manifest in the eye.
Yeah.
So again, with diabetic retinopathy, if you do suffer from it, or if there's anyone there that's concerned, they usually get seen at the eye hospital once a year, and then the year after that, they get seen at the optician. So they're getting seen every year by some sort of eye professional to make sure that they.
And again, so the same question again, is there a treatment?
Well, so yeah, I think with this again, there's, you can do one thing, which is obviously maintaining your blood sugar levels,
Yeah.
which can help. With this, unlike glaucoma, there is some treatment where you can do something called photocoagulation.
Ooh, that's a mouthful.
It's a big word, but it's something simple. It's just it's lasers at the back of the eye. And what they do is they limit the damage effectively,
Wow.
because if there is blood leakage, and let's say you can't control your blood sugar levels, you're going to have blood leakage very regularly.
Right.
So what will happen is you'll be getting seen at the hospital to laser and stop those blood leakages when they're coming up. So you're preventing any future loss. Similar to glaucoma, if there is some vision that's lost, unfortunately, it's very hard to recover that.
Yeah. Okay, well, thank you. And we have one more, and this was asked by one of our members. Is there any, what is RP, and is there any cure?
So RP is acronym for retinitis pigmentosa.
Yes.
And effectively, it's a rare genetic disease which affects the lining of the retina, again, the rods and cones. And yeah, it's a very rare disease, which what happens is with this, again, it does start from the outside. So you start getting a bit of tunnel vision, but it can affect the middle vision as well in the latter stages. But another common thing is it affects your night vision first, because it affects your rods, which your rods are on the outside of our vision first, and the cones are in the central part of the vision. But the rods don't get affected to an aspect so much that they lose vision, but they start dimming their properties. So night vision is something where if you have really good cells at the back of the eye, then they can really pick up on things, even when there's low level lighting. But what people find with retinitis pigmentosa is they actually lose their nighttime vision, and that's the first sign. And then your day-to-day vision of peripheral vision gets lost, and then in the latter stages, it can affect.
Next section. Ola, do we have any comments or questions from members, from viewers?
We've got one saying, so is glasses enough, or would a hat with a pig do as well?
Sorry,
in
say
the
that
sun,
again?
I think that they're saying in the sunshine when you're out there, are sunglasses enough, or wearing a peak cap as well is sort of helps to protect your eyes?
Yeah, so the best solution you want is wraparound sunglasses that cover all the eyes, so light can't even get in from the back. It covers it right to all the way around. And you want them to be sitting close as possible to your eyes. So you've got to remember, if you have sunglasses which sit lower down your nose or don't wrap around, then you've got sun hitting the back of the lens of the glasses and then going back in your eye.
Oh yes, from behind. So, yeah.
So I'd say wraparound. But if you can't get wraparound glasses, or you don't think you look sexy in them, and you're going to go for normal sunglasses, then possibly wearing a normal cap, which acts as a deflection for most of the sun, and sunglasses can suit.
Yes.
But yeah, they're both really good tools. So I'm happy someone brought up the fact of wearing a cap. A cap is such a simple tool to wear to get rid of the harshest type of light.
Yeah, fantastic. Thank you very much. Okay, well, I now have a few questions, a few what ifs. So, and this is kind of when, I suppose in a sense, when accidents happen. What should we do, Dhruvin, if, for example, you're cooking and you get a bit of splatter of hot oil in your eye? What should one do?
Jump up and down and scream, first of all. I mean, that's but yeah, it hasn't happened to me, but it sounds very painful. But I think what you want to try and do is, you want to get to a sink and try to wash that eye out as soon as possible. Getting some water into there. I think if it's hot oil as well, it's very tough. You might have caused some corneal problems or issues there, dependent on how big the droplet was.
Yeah.
I would suggest going to see your optician or getting some further advice so they can look at the front surface and see how deep the damage is, because if it was a large splatter, it could penetrate deep into the corneal structures and not recover. The cornea is very good and it recovers quite quickly if it's somewhat superficial, but something that's very hot and in the eye and you don't maybe get out in time can cause further implications. So I say, eye wash is the main thing. Cold water, just trying to get that hot splatter or whatever it is into the eye. And then following that, you just want to be blinking to get rid of any extra debris within the eye.
Excellent. Another question is about, I suppose, another DIY or sort of, if you get some grit in your eye, your kind of first reaction is to try to rub it off or to take a towel and rub your eyes. What should you do if you get a bit of grit in your eyes?
Yeah, sure. So if you're talking about, foreign bodies that come off from the road.
Yeah, a bit of sand or a bit of something, you're gardening, a bit of soil or...
with sand and small, dust or whatever, 9 times out of 10, if you just blink, your eyes will naturally get rid of what it is, because your eyes are made to naturally push out anything that's not supposed to be there. But if you're talking about larger structures that have gone in the eye, let's say DIY or something that is, if you're, when you drive, you can get stones that hit the windshield. Let's say something hits you very fast like that and is large. Then you're obviously going to want to get that looked at because it might have caused damage.
Okay.
But again, what I'd say is if it's something small, keep blinking, try to wash it out of your eye and assess it. Your eye will react very, you'll know within 30 minutes to 1 hour if it's feeling bad, it's got a lot red, it's feeling painful, that if it's something serious.
Yeah. So another one, what do you do if you have itchy eyes?
Yeah, so itchy eyes comes from many different things. So it could be allergies, seasonal allergies, if you have hay fever, etc.
Yeah, hay fever,
You already know what to do if you have hay fever. You're going to manage that with antihistamines and other methods. You can also have allergies which are just normal day to day, in your home environment, whether it's, things like dust mite or, your dog or cat causing issues. So what I say when it comes to allergies is always keep a diary. Note when you're feeling the symptoms and then note what you were doing at that time or what you did a few hours before. And then itchy eyes can also be because of dry eyes. So dry eyes is a whole different topic. It could be because of your environment, hot and cold air, or you just naturally don't have enough oils within the eyes and you need to be lid massage, etc.
So if somebody suffers from really itchy eyes, it would be worth them going to see an optician to sort of say, I've got itchy eyes, or to go and see their doctor?
Yeah, I'd do both if it was me personally. Yeah. I do both because they're both going to ask, have you been to the other or, before you come to me? Yeah. And then you need to book in with both, because one could be a systemic problem, which is your, bodily body problems, with your health outside of the eyes, and then the other could be just related to the eyes itself.
Yeah. Okay, excellent. Thank you. Okay.
One question on that.
Oh, we have a question.
Is it bad to itch your eyes?
Is it bad to rub your eyes?
I would say you should try to limit rubbing your eyes as much as possible. Because actually rubbing your eyes increases the pressure in the eyes. Yeah. And it can cause keratoconus, which is the thickening of the cornea, if you're rubbing the cornea too much. So if you are someone that rubs your eyes a lot on a daily basis, I would recommend you to tie your hands behind your back, because it's not something you should be doing. But, once or twice during the day, and if you're gentle is okay, but just don't be aggressive with rubbing them.
Yeah. Oh, well, thank you. That's very...
One more. What about eyelashes in the eyes? What do you do about that?
So if you get, so sometimes your eye, you get a loose eyelash that goes into your eye. What should you do?
Yeah, so I think going back to similar, just making sure you're blinking and trying to get it, if you keep blinking, it should go out after, 5 or 10 minutes. If you still find it still there, what I would suggest is getting someone to look into your eye and pick it, get them to pick it out with a tissue. Obviously, get them to wash their hands, but a tissue or a cotton bud is probably better, and then get them to get it out. If you don't have an option or the luxury of someone there right then and then to help, you can try do it yourself, but I would be very careful, because if you are again using tissue in your eye, it can damage your cornea and your tear film and cause some issues there. So I'd say just wait it out. Once you blink, throughout your eyes, the way it's made, it can just blink out stuff like eyelashes throughout the course of a day. So I'd say rest easy and try to just bear with
blink it out. Yeah, that's really good advice. Thank you. Okay, well, we're now going to go to our third section of eye sort of urban myths about eye and blindness and that kind of thing. So my first question is the most obvious. It's what we hear when we're little, and what you see in lots of comic strips as well. If you eat a lot of carrots, will it make you see in the dark?
Oh, this is a great one. So let me tell you where this is a yes and no. So let me tell you where this came from. So in the World War II, when the British were fighting the Germans, what happened was the British had a new piece of technology they had radar technology, which allowed them to spot where the planes were. And they didn't want the Germans to know they had this technology. So what they did was they released a rumor which said, actually, we've been eating lots of carrots. That's why we can see your planes in the nighttime. Because of the carrots, we can now see all your bombers in the nighttime. And therefore, we've been able to, capture them or shoot them down. Now, the Germans were so intrigued by this, this myth spread, and everyone was thinking, oh, we must eat carrots to improve our night vision. And matter of fact, carrots do not allow you to see at night, for one, but carrots are good in general to maintain the health of your eyes and the vision, because they have vitamin A. So vitamin A contributes towards healthy vision. So carrots won't let you see in the night, but they contribute towards normal health of the eyes.
Oh, excellent. That's an excellent story. Thank you. Now, another one. Can you damage your eyes if you swim, if you open your eyes when you're swimming underwater in a swimming pool?
Yeah, so I'd always recommend swimming with swimming goggles, because especially in a swimming pool, the amount of chlorine and chemicals they have in that is really aggressive to your eyes, the tear film. So your tear film has special oils and different properties to make sure it's lubricated in the right way. But if you're swimming without any goggles on, you're really disrupting that natural tear film, and it's going to cause you issues. So I say, yes, it does damage the eyes. Therefore, wear swimming goggles when you can. Okay.
What about in the sea? Is that the same kind of idea with the salt and all the sort of sand in the seawater?
It's a little bit less aggressive than normal swimming pools. But I'd say, look, I'm not here to stop anyone having fun. If they're going to be in the sea once in a while and they like to open their, I'd say do it for a short amount of time, and don't do it. Don't be doing it every day is what I'm saying. Like every other hour. Because that doing that repetitively is going to affect your eyes. Once in a while, your eyes are good enough to recover. But yeah, that's my main, I'd say my main.
Fantastic. And I have another one for you, Dhruvin. Is bungee jumping sort of bad for your eyes?
In a similar way to swimming, when your eyes are in the water, your tear film gets affected. When you're when you're bungee jumping, generally you should have some sort of eye visor or glasses on. But I have seen people that bungee jump without anything, protection on their eyes. And when you do that, what's happening is, again, the speed you're falling
pressure, don't you?
Exactly. You get it's like if you're driving, you open the window, you're going to get suddenly...
The wind is pressure,
If you imagine you're doing that bungee jumping, but that's on steroids, you're going to affect your tear film again, and you're going to get dry eyes. They'll be getting uncomfortable. So with bungee jumping, wear protective glasses, or close your eyes when you bungee jump.
So I suppose if somebody has an eye condition and they want to bungee jump, it's better if they put glasses on.
Yeah, they'll have like
protection.
the bigger scale strap-on ones where you can, and then you can enjoy, because actually opening your eyes and dropping at that speed, you're naturally gonna close them because your eyes are gonna feel so strange. Yeah. So I would recommend having, those protective
some goggles,
glasses.
Excellent. Now another one: are bats really blind?
No, so bats actually have eyes; they can see. They're just really, really small. They don't have color vision like humans do, and the vision's not as good, but they can see.
They can see. Good. And going further with animals, can a person do a bit like a bat? Can a person do echolocation? Because we've had a few articles about hearing about like there was this boy I think who would do echolocation riding his bicycle. So people are kind of asking, do people? Can you really do echolocation?
Well, I mean, just as a disclaimer, echolocation isn't within my remit, my professional remit, but my personal opinion on echolocation is I think the brain is fascinating. I think the ability for other organs to adapt and be able to do amazing things cannot be disregarded. So if there is examples of this happening, then I wouldn't question it, because I can't. But from my professional hat, my answer is I don't know.
Right. Yeah.
One question: is it true that when you lose one sense, the other ones get sharper, like really sharp, like Daredevil kind of sharp?
Yeah, no, it's very true. I mean, I guess many of those listening as well have probably, that do have visual impairments can support that and say, their hearing or their touch has improved because they're reliant more on these other senses than their eyes. But yeah, certainly.
Excellent. Another one: if you read too much, can you actually use up your eyes?
I love the way you phrase that. Use up your eyes.
That's when you're told, go to bed and stop reading. You're going to use your eyes up, or
yeah. So what
is that true?
When you're reading, if you I guess everyone can do this now. If they put the finger in front of their eyes, and let's put it. If you put it in front of your eyes and you bring it towards your nose.
Yeah.
You can bring it towards your nose very slowly. You can notice your eyes come closer towards each other, and then they kind of go cross-eyed.
Yes.
So you have muscles which control your eyes, and when you're reading, you're usually engaging those muscles because you're reading, quite close up.
Yeah.
Now, if you were to go to the gym or exercise, you wouldn't keep doing the exercise for a long amount of time unless you're a professional bodybuilder, marathoner, or whatever.
Even they stop to stretch and recover. Yes.
Exactly. So in the same way, when you're reading, you really do want to break the cycle of the demand you're having on your eyes.
Right.
So what I usually say is, the 20-20-20 rule applies to this as well. I mean, generally what you can do if you're reading or using screens every 20 minutes is you want to look away for 20 seconds, at least 20 feet away. So that means down the corridor, out the window, at a family member across the room. They might think you're weird because you're looking at them, but just tell them you're having a 20-second break. And what that'll do is it'll just refresh your visual system, so then your eyes can carry on reading. But if you don't do that and you carry on reading for a few hours, you're going to really feel the strain in your eyes, and that can lead to headaches and tiredness.
Right. So really, you're saying 20-20-20. So every 20 minutes, look for 20 seconds, something 20 yards away.
That's correct. Yeah, 20 feet away. Yeah, as far as possible.
20-20-20. That's a good rule. And I suppose that also goes when you're working at the computer as well.
Yeah, exactly. Anything you
or the
do
television.
within the arms, anything you do within an arm's length or anywhere around that remit, screens, books, you should do that. Obviously, with the TV, you usually have it far away, so you don't need to, unless you're like.
I do have to sit quite close myself.
But even with the TV, if you're using it close, again, the same rule applies.
Excellent, thank you. Now, another fun question is have people tried to train different animals than a dog to be like a guide dog? Have different animals sort of done the job?
Yeah, so Adette, you can probably elaborate on this. From my knowledge, I know that there haven't been any successful as dogs
Yeah.
that have been able to help the visually impaired or blind. But yeah, Adette, you might have some more information.
Yes, I think they tried. I think they tried because sometimes people are scared of dogs, or you know, it takes a long. A dog would only work for about 8 years or so, from the time he's old enough to be a guide dog till the time he has to retire. So it's a lot of investment for maybe not that many years in a sense. So I know they tried pigs, they tried monkeys, and they have tried, I think, miniature small horses. So even smaller than a pony. The problem with the horses is that they don't do stairs, they don't do escalators. You can't really go in a bus with a horse. It won't kind of sit on the floor like a dog. And it does poo a bit everywhere. So, but they are very intelligent. They last many more years. You can have a trained pony, I think, for at least 20, 25 years. So the investment is good, but it kind of only really works around the farm. So it's not really useful for an urban environment, so to speak. But yes, that was an interesting question. So I think I have another one. Oh yes, about going back to the exercises. Are there exercises that people can do to strengthen their eyes?
Yeah, sure. I think there's a few you can do, which anecdotally have helped people strengthen the muscles around their eyes.
So maybe we'll look at another session where we can show people different exercises in the future.
I mean, the exercises, I mean, I can show you now that there's not too many. I mean, the two main ones that what I'd say is a finger to your nose.
Yeah.
And so you start with your arm straight in front of you,
Yeah.
and finger all the way there. And then what you want to do is, while focusing, just keep focusing on the tip of your finger and bring it towards your nose. And you want to do that about 7 to 10 times in a sitting.
Okay.
And what you're doing there is you're strengthening your extraocular muscles. And in the same way, what you can do is, again, if you want to test out your other muscles, is you can cover one of your eyes.
Yeah.
And then put your finger out, and you want to kind of move it in all different directions. I'd say, kind of 8 directions. You've got your diagonals, you've got down to the bottom, to the side, crossing over. And again, doing this for maybe 5 times in each direction. And what you're doing there is you're making the muscles work, because generally you don't look that far out when you're
Okay, so quite far, right.
So you're making them work basically, and
okay.
you can do those two. I think those 2 exercises really make sure your muscles are working, or you're kind of training them effectively.
Okay, and what about? I think we on a earlier Facebook Live we were talking about blinking. Is it good to kind of blink your eyes quite a lot to kind of remind them to blink, and so to speak?
Yeah. So when you're not doing any focus tasks, so when you're just walking or doing something that is very passive, your eyes will blink usually 15 to 20 times in a minute, which is the amount you need to be blinking. But when you're doing a concentrated task like reading or looking at a screen or trying to paint, because you're concentrating, your eyes stay open and you only blink 3 times in a minute. Therefore, the blink has a very important process where it re-lubricates the cornea of the eyes. And if that doesn't happen, your vision gets blurry and they become dry. So blinking is really important. So yes, I would try to remind yourselves to blink, especially when you're reading or on the computer. Or what I suggest is putting a post-it note or sticky note on your book
blink.
or screen and write blink in capital letters, and therefore you'll remember to do it.
Excellent. Oh, thank you so much. Have we got any questions, Ola? Do we have any comments or questions?
Not anymore. We just got someone saying the carrot and the scene in the dark of the World War II is one of the biggest propaganda that people still believe right now.
People still believe, yes.
And wait, so why did they say as blind as a bat if they're not actually blind?
Someone must have made up the saying, right?
It's an urban myth.
Yeah, it's the myth. So they can see, but some people think that's a blind because they're heightened, other skills. They forget they have some eyes.
Yeah. Okay, well, thank you very much, Dhruvin. I think we've had a great time. Thank you for your eye health information and comments on the urban myths. That was great fun. Thank you. And just to remind everybody, next week we have Suzanette talking about diversity, and do come and join the conversation. So from Croydon Vision, bye-bye everybody, and thank you, Dhruvin, again. Thank you for joining us.
Bye everyone.
Bye-bye.
Bye.